My name is Yasmin Chandani, and I will talk today about my project, which is What Do Women Want? A patient-centered approach to expanding family planning access in pharmacies in Kenya. I'm very privileged to be one of the 2024 Thematic East Africa Leadership Journey members. First, a little bit of background. I'm the founder and CEO of InSupply Health, an East African health advisory firm. We design people-centered, scalable supply chain solutions to expand access. And we are 6 years old. I'm passionate about equitable access to health and making sure health systems are inclusive, reach, and serve even the most marginalized populations in any given country. I believe when communities have a voice in solving their problems, solutions will be owned by them and more effective. And the project I'm going to talk about today builds on two in-supply health grants funded by the Bill and Melinda Gates Foundation. The first is implementation research that focuses on learning more about clients and pharmacy providers, enablers and barriers. And the second is a project about the ecosystem for optimizing the pharmacy channel for family planning. A little bit about context. As Kenya transitions to middle income, community pharmacies will become an increasingly important delivery channel for quality primary healthcare services and products. And what this means is that governments will have to take on increasingly financial responsibility for purchasing contraceptives and other donor-funded commodities. So global funding for family planning is a stool with three legs: domestic government expenditures, international donor contributions, and consumer spending. And currently, the donor contributions are the largest, but that will shift over the next few years. So this project is aimed to help with that shift and answer questions that the government can use in policy. Currently, pharmacies are the first point of call for health in most families in Kenya, except for family planning. And we wanted to equip pharmacies and the ecosystem with solutions so women could safely and confidently access a new channel for family planning services and products. And my aim in this project was to amplify women's voices, needs, and desires so they could access family planning through the pharmacy channel. And I aim to do this through influencing policy and incentivizing pharmacies to deliver these quality services. The project builds on two types of research: human-centered design research and implementation research that took 18 months. We partnered with 27 small and medium-sized pharmacies across 10 counties and towns in Kenya. And we demonstrated that the number of women seeking family planning through the pharmacy channel increased, both through injectable sales, which went up, and new and repeat pharmacy clients. And what was key about the pharmacies that showed this consistent increase was that they implemented client-facing solutions. So client service and retention, the use of social media to create demand and build trust, and a safe space for clients, and a focus on quality counseling. And what did we hear about what women value and want? They want confidentiality and privacy. They want convenience, empowerment, personal attention and quality counseling, and ease of use. And this is really important for the self-injectable, which is a product. The next step of this project is to continue the analysis and essentially translate the evidence that we've generated to design implementation frameworks and to develop and disseminate policy briefs, which can influence how Kenya moves forward. A little bit about my leadership journey before I close. It has been transformative for me as a leader in so many ways, and I feel I've grown in all the areas of the leadership roadmap. Two areas have stood out, though. The first is helping me to be a more inclusive leader, and I was particularly inspired by the Ally and Amplify session. And the second is, given where InSupply is in its growth phase, it's really important to me to focus on how to develop others and amplify their voices, their impact, and the opportunities they have. And the most impactful aspects of this journey for me would definitely the assessment reports. I learned so much about myself and became a lot more self-aware from reviewing these and having the chance to talk about them with the cohort and my mentorship group, and especially my coach, who was amazing, really helped me put it in context. And the other things I would say, the leadership sessions and the office hours cannot be overemphasized. They've really made such a big difference to me. Thank you very much for your time.